Good evening and thanks for joining us. I'm Loretta Beniti in for Tim Boyum. President Donald Trump is making moves to address the nationwide epidemic of opioid abuse. At the White House today, he declared a public health emergency and called for one opioid drug in particular to be pulled from the U.S. market. And that's our top story tonight. The president says the federal government will be quicker in dispersing grant money to agencies fighting drug abuse. He also says the U.S. Postal Service will strengthen inspections to stem the flow of the drug fentanyl into the United States from China. It's a powerful synthetic opioid, many times more powerful than heroin, that many first responders and law enforcement are finding in the streets. The president said we could be the generation that ends the opioid crisis.
Each of us has a responsibility to this effort. We have a total responsibility to ourselves, to our family, to our country, including those who are struggling with this addiction. Each of us is responsible to look out for our loved ones, our communities, our children, our neighbors, and our own health.
And one North Carolina congressman is helping to lead the charge in Congress on the opioid epidemic. Republican Richard Hudson of the 8th District has worked to get federal funding to combat the crisis. Our Washington Bureau reporter Samantha Jo Roth has more with Congressman Hudson from the White House.
Well, thanks, Loretta. Congressman, we're here at the White House for an opioid event. What are you doing to combat that crisis? I know you had a hearing yesterday talking about that federal response.
Well, we've been years on this very important issue. You know, this is hundreds of thousands of deaths from opioid overdoses. It's a scourge that affects all of our communities. And on our Energy and Commerce Committee, we've been working for a number of years to try to get more resources to communities, to try to help with prevention, to try to help with treatment, to try to help with education. You know, it's such a complex issue. That's why today's announcement by the president is so exciting, and I really appreciate his leadership on this important issue.
You know, the president is declaring the opioid crisis a public health emergency instead of a national emergency. Do you think that this is good enough?
Well, I think this is a huge step, and I really applaud the president's leadership on this, of taking this epidemic so seriously, because the challenge is, because there's so many aspects of this, whether it's education of parents and healthcare providers, whether it's tracking prescriptions that are written by physicians, that are filled by pharmacies, it's a law enforcement issue, it's a healthcare issue. You know, there's no one silver bullet to fix this huge scourge of opioid addiction, and so it takes a comprehensive approach, and it takes the seriousness that the president has put on this. That's why his announcement today, it was so important.
You know, I feel like a lot of people think that we've been receiving mixed messages from the administration, with the president saying that he would declare it a national emergency just last week. Have you been receiving mixed messages, and were you expecting this announcement today?
No, I think the president's been very consistent from day one that he recognized the seriousness of this opioid epidemic, and you know, I don't get caught up on semantics, but what is important is that he's today given a strong signal to the American people that his government is going to be unified in our efforts to make sure we're getting support to communities, to law enforcement, to healthcare providers to stop this epidemic. And so I think his clear voice, his consistent voice on this has been important, and that's why we're going to succeed.
Next question about funding. You know, some people say that doesn't include extra money that is critical to this epidemic. The HHS Public Fund only has about $57,000. What are your thoughts on that? How are we going to get more money for this?
Well, we've already allocated over $1 billion towards opioids, whether it's treatment or prevention. About half of that has been actually sent to states, and we had a really important hearing this week where we brought in the DEA and CDC, FDA, NIH to talk about our efforts so far, to figure out where we can improve, what are the gaps. We are putting the resources there. This is a priority, and we're gonna have the resources to do it. But you want to be smart about it, and you want to make sure we're spending the taxpayer dollars on things that are working, and we want the money going to the communities where they can really have the impact.
You know, some say the president may ask Congress for more opioid funding in an end-of-year spending bill. Do you think that this is likely to get accomplished?
Absolutely. You know, you look at, like I say, with CARA, this passed last year, and 21st Century Cures, we spent over $1 billion and we offset all of that money. So it's a priority. We can cut things in other places to pay for this. As a fiscal conservative, that's important to me. But you know, you fund your priorities, and you may not be able to fund other things. This is a priority, and that's why today's announcement by the president is so important. Is he's saying loud and clear, this is a priority.
Now, there is some concern that some people say that the president has yet to name some central players who will be responsible for carrying this out, like a drug czar, a secretary of Health and Human Services. Is this something that you're thinking about?
Well, it's important to get those folks in position. It's been difficult to fill this administration when you've got the opposition party in the Senate on every single turn forcing 30 hours of debate before we could even decide to have a vote, let alone then another 30 hours to have a vote. They're delaying, they're stalling. It's really a shame, and I think the American people recognize that it's time to do their job. Let's get these folks confirmed. In terms of HHS Secretary, I think an announcement will be coming very soon. I'm excited to hear who the president's going to pick, and we're ready to get to work with them.
Why do you think a public health emergency instead of a national emergency is the best way to go about dealing with this opioid crisis?
Well, it helps us get the resources in place. It also helps us get flexibility when it comes to how those dollars are going to be spent by the agencies. You know, this is a complex issue, and so it's going to take a continued comprehensive approach to it. And what the president's done today is, through this declaration, is allow us to get the resources where they're most needed.
Well, thank you so much for joining us, Congressman, and sending it back to you, Loretta.